As the international community debates the escalating Iranian nuclear missile crisis, Israel prepares for worst-case war scenarios. In recent days, Israel's Ministry of Defense, in close cooperation with the Ministry of Health, conducted drills simulating an unconventional terrorist attack, a biological outbreak of a contagious disease attacking the cities in northern Israel. 9 kilometers from Nazareth, healthcare workers of Afula's Ha'emek Hospital were drilled on their capacity to treat up to 5,000 patients per day.
There are a lot of talking in the media about Iran and conflict with Iran, but as we are quite used to such threats and such unknown, I just have to be prepared for anything. In the Middle East, very shaky and unstable situation, anything can happen here.
In May of 2010, Israel's Rambam Hospital, situated in the coastal city of Haifa, was drilled for a simulated chemical terrorist attack. This, the largest medical facility in Israel's north, is also a world leader in the treatment of trauma. As a chemical attack could cause far greater numbers of casualties than conventional warfare, substantial coordination was required.
It's the hospital teams, physicians, nurses, general people from the hospital who are actually moving the patients from one side to the other, have to coordinate with the authorities in the city how to manage the civilians in the picture. Including the social workers and the physical therapists. Everybody has a role, everybody participates.
And not just Israelis were taking note of the drill's effectiveness.
Most of the officers and enlisted in charge of their response are local, so they know the lay of the land. They've already established the necessary contacts of the individuals that can make this all work. Very well organized. Impressed with the exercise.
Early 2012 will find Israel conducting simulation drills in preparation for a radiological attack. As Iran signals its readiness for a final nuclear confrontation, Israel is sending signals of war preparedness. Retired Lieutenant Colonel Michael Segal, a former Israeli defense intelligence specialist, blames today's defiant and empowered Iran on the world's passivity towards past Iranian acts of terrorism.
Nuclear weapon will provide them with the opportunity to do more of what they are doing today, which is terror, under what we call a nuclear umbrella. They are immune now. They are immune today because they haven't paid any price for conducting terrorist attacks in the past. Iran is preparing for the final confrontation with the West. And indeed, this is the next big thing in the Middle East.
Unknowingly, Israelis may have picked a fitting venue for a mass casualty exercise. Northern Israel's Ha'emek Hospital in Hebrew means the Valley Hospital, referring specifically to the Valley of Jezreel, the same place prophetic scriptures foresee the final confrontation of the armies of the nations in the great Battle of Armageddon. And today, in its shadows, 21st century Israelis are preparing for a future worst-case war scenario. Marnie Blom, Axe News Network, Afula, Israel.